Hi, this is Dr. Joe Albano. Today we're talking about rotator cuff symptoms. So, first one is pain. You can have pain anywhere in the shoulder. Commonly, it's in the front of the shoulder. You might have pain at night when you're sleeping on it. This is kind of interesting why that happens. So, here's the ball on the socket. During the daytime, you're standing up and the ball, the humerus, is down like this, but at night when you lay down, it comes back up and impinges on other tissue in there, and that can cause you pain. Even if you're not laying on the shoulder, if you're just laying on your back or something, that still can happen. So you can have pain during the day, pain at night when you're sleeping. You have pain when you are moving it and doing things. Typically, it's any kind of overhead activity like this motion. Anything above 90 degrees is typically not going to feel too good. So those are the symptoms. What do you do about it? So always rest, ice, compress, elevate, relative rest, avoid aggravating activities, whatever it is you're doing. If it's your dominant arm, try to use your other arm. So I've had rotator cuff tear on both my shoulders, and I am right hand dominant, and I was a pitcher back in the day, and I was a quarterback, and I threw the javelin, had a school record. I could huck stuff, and then I injured it with time. Those are my symptoms were pain. So what I learned how to do though is I learned how to use my left hand because I'm right hand dominant, and you can try that. Most people don't want to do that because it's not their dominant hand, but if you really want to still do some things, you can do it. So now I can actually throw left-handed. Not the same as my right hand, but it's not too bad. Another symptom is not just pain, but weakness when you're doing the different motions, and in particular, it's this motion, but anything you're doing, you're going to be weak in there because it's hurting you. So, what do you do about this? So, again, the relative rest, ice is always good, 15 minutes on, 45 minutes off. Hard to compress the shoulder, and if you're sitting or standing, you're elevating it. So, other things you can do steroid injections. Again, not a big fan of this if you listen to any of my other videos. Steroids do not heal anything. They will damage tissue every time you put it there. In the shoulder, however, you can put it in this subacromial subdeltoid bursa, so you're not really affecting any significant tissue like the tendon. So you can get away with it a bit in the shoulder, in my opinion. But always better to not do it if you don't have to, I think. So you can get surgery. That's really common with this. You don't always need surgery though. If you have a big, full thickness, full width tear, yeah, you're going to need surgery. The only way to heal that is with surgery. But most tears that I see anyway are not that. You can have tears that are like this, partial thickness like this, intrasubstance tears that go lengthwise like that. These are great, respond really well to regenerative injections such as platelet-rich plasma, PRP, fat, bone marrow, putting them into these areas. It works really well. In fact, I'll tell you a story of a patient, Fred. He is, when I saw him initially, he's in his mid 60s, and he was a master's level butterfly swimmer, international level. He was ranked in the world. And he, back in the day, he even went to the Olympic trials, didn't quite make the Olympics, but he was that good. And swimming is his life and loves butterfly. That's his main stroke. So he came to me after he tore his rotator cuff, saw one of our local respected surgeons. The surgeon said, yep, we can do surgery on this. What Fred heard, I don't know what was said, but he heard, you will never swim again. And so he never went back there, wound up seeing me, and we did these injections on him. And the next year, Fred was able to get back to swimming. And guess what he got? What place in worlds? In the 50 and 100, number one in the world the next year. So what that told me was that you can actually strengthen and heal these rotator cuff tears. And his was pretty significant. It was a full thickness tear, 50% width. That's a pretty big tear. And he did well with it. So if you want to find out about treatment for your rotator cuff tear, look us up on the web, albanoclinic.com, or give us a call. Thanks for listening.